When I meet families or patients, one of the first questions they always ask is, how long is it going to take me to get better? And encapsulated in that question is frequently the question, if they're not walking, is, will I walk again, and when will I walk again? Well, first it depends on your problem. Have you had a stroke, a brain injury, a brain tumor? And your doctor's not being difficult when they're a bit evasive and say, well, it's difficult to predict. It can be difficult to predict. And a lot of times we're really surprised is that when I would do team conference with our therapists and nurses and the rest of the staff, at the first team conference, I would ask everybody to sort of predict, and they'd have to write down, and we'd save them, how well do you think this patient's going to do and how long will it take? And uniformly, we're not really good at predicting exactly. So don't be surprised if your doctor or your therapist is a little evasive about that. Now, the good news is that the vast majority of stroke patients walk and walk out the door, maybe with an assistive device, maybe with a cane or a walker or a brace. But the majority of patients will walk, and the vast majority of patients will improve from their status. Recovery is much more rapid during the first 3 to 4 months, 90 to 120 days. But it doesn't mean you won't continue to improve, but you may improve more slowly. The other thing is that we call dedicated systems, systems that don't take up as much space in the brain, like motor function, moving your arm, moving your leg, recover much faster than what we call distributed systems, systems that require much more of the brain. So the ability to speak is distributed in a larger area of the brain. Attention, concentration, cognition are distributed throughout the brain and therefore take longer to recover than that maybe early 90 to 120 days. Dose is important. So just as your medication is important, the dose of rehab is important, and the more deliberate practice, the practice of that specific task that you do, the better chance you have of getting better. We have a reservoir of ability, and this is this whole concept of neuroplasticity, is that the brain can repair itself if you have enough dose of a specific functional task in a highly motivated environment. So that we used to think that was only children that had the ability to take advantage of another part of the brain taking over. But we can also see that in adults if we do the right kind of rehabilitation. And finally, what happens is we can improve and the patient improves and then reaches a plateau. And people might think, well, that's as good as they're going to get. And we used to be able to keep patients much longer, and we could then move them off of that plateau and keep doing what we're doing. Well, now, once somebody reaches a plateau, they usually have to go home, and they may continue with home health therapy, but even that eventually stops. Patient reaches a plateau. And so if you're a patient or a family watching this, and you are at a plateau and it's been a while, go back and get reevaluated and see, could I move off this plateau? If I had more therapy and we address maybe some different problems and look at this differently, we can move off of that plateau. So just because you reached a plateau doesn't necessarily mean we can't get off of it.